Hello. Last time we brought someone to the brink of death by knocking them into cardiac arrest. The flow of blood through their body has been disrupted and they're in big trouble. So we're going to do our best with this part two to try and bring them back. Boy, I hope we have enough time. I know you guys like to line up at the door. So if we don't quite make it to bring them back, nothing stands in the way of line up at the door time before the bell. So anyway, so first thing that you are likely to do if you're in the room and someone's heart starts to fibrillate, they're going to collapse. And the first thing you're likely to do is to call 911 and um, and then hopefully begin CPR or cardiopulmonary resuscitation. Now, what you may not realize about CPR, um, notice where you place your palm. You're placing it on the sternum at the base of the rib cage. You may recall when we first started talking about the circulatory system, I said that your heart is located right dead center beneath the sternum, leaning left, and right above the diaphragm at the base of the rib cage. In other words, you're putting your hand directly over where that heart is. And so when you're doing the chest compressions, you're basically pushing down on that heart. And so what you're doing is you are manually beating that heart for it. The atria and ventricles, there's just these chambers that and normally there's muscles in the walls of these chambers that cause the blood to flow. But what we're doing now is we're just like physically squishing the heart to kind of launch the blood. The valves and the blood vessels are going to make sure that the blood goes in the right direction. So by physically pushing down, all you're doing is you're keeping blood flowing. Now, it is very unlikely that you are going to fix the person's heart with this or bring them back if they've slipped into unconsciousness. The point of CPR is to keep blood flowing because there is one particular organ that cannot live very long without oxygen, and that is the brain. And so the idea behind CPR is to keep blood flowing so that the brain has adequate oxygen to stay alive. Because I think it's like 3 minutes or something before brain cells start to die. And so this is a very important thing to help prevent permanent brain damage. So you're doing CPR, but you're likely not going to stop cardiac arrest with this. And so then hopefully paramedics will show up and they may bust out the paddles. This is called defibrillation. Remember, fibrillation is that loss in coordination of the heart where the ECG is chaotic. This is the defibrillator. And what they do is they rub the paddles together and then they place them on either side of the heart and they hit a little button and then it delivers a shock. Now, a couple things about this. First of all, why do they rub the paddles together? There's two reasons. The first is that it looks really cool, but then the other is they actually apply a conducting gel onto there. So they kind of like squirt this goo onto the paddle, and then they're rubbing that goo across both paddles evenly. And the purpose of that goo is to help the electrical signal effectively transmit from the metal plate to your chest. So that's why they're rubbing the paddles together. Then before they shock, they say clear, and the idea there is to say basically, we are going to zap this guy with quite a bit of electricity, so back away. And then everyone in the room kind of lets go, oh, all right, and then they deliver the shock. Now, what is the point of the shock? The shock actually stops the heart. The point is to stop the heart. And the hope is that by stopping it, it will allow the heart to start up with its natural rhythm again. So to think back to my analogy where I have all the students in the room saying, pump, pump. Well, during cardiac arrest, it's chaos, right? All the kids like pump, 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 all over the place. Well, a defibrillator is a bit like, the principal or some person of authority coming into the room and yelling, quiet, and all the kids just kind of like, ooh, and stop, like, oh. That's the idea. That shock is supposed to stop all of that ineffective, unproductive electrical activity with the hope that the SA node can then initiate a normal heartbeat again. It's a bit like hitting Control-Alt-Delete on a computer or restarting a computer. When things go wonky, they're not working. We don't know why. We just restart it and magically it starts to work again. It's kind of the same idea here. Um, Note that they have automatic ones now. The school has a number of these, and kind of a sad. These are meant like a little robotic voice comes on and like walks you through how to apply these, and then it detects if a shock should be given, and if so, it gives that shock, and if not, it doesn't. So these are kind of there to sort of help in an emergency, so that first responders can have those available. Interestingly, we keep them in. I think there's 3 in the school building. One by the gym, and then one by each theater. And the reason we put them there, this is sad, it's very unlikely that a high school student is going to go into cardiac arrest. So we keep them in places where grandparents may gather to watch events, because they're the ones who are more likely to have a problem with this. So, little fun fact. Anyway, so hopefully the defibrillator is able to treat the crisis and get the heart going again. But we still have the problem of this blockage. So what do we do about that? Well, a couple options. One is a bypass operation. Um, in a bypass operation, what they do is they actually go into your leg and they take out a vein, a little bit of vein. It's called the saphenous vein. And remember, we said that you have, there's extra veins and they're not quite as important. There's a lot of bonus veins. So this one's just kind of a bonus vein. You don't really need it down your leg. So they do a little craft project. They cut that little bit of vein out and then they stitch it to the aorta here and then below the blockage on the coronary artery, the blockage being represented, I believe, here. So basically, this allows the blood flow to bypass the blockage and continue on to the heart muscle. And so here you can see they did 3 bypasses, and so you'd call this a triple bypass. And yeah, there you go. Another technique that they can use is called balloon angioplasty. And basically they take this tiny balloon, it's basically the diameter of a thread or of like a wire, like a narrow wire. And they put this device with the wire, they kind of run it up through your femoral artery, and they run it all the way up. There's little metal bands on the end of this metal wire, on the ends of this wire, so they can track it in an X-ray. And they run this wire all the way up into your heart through the aorta. Whoops, I guess it'd be this way, through the aorta, down into the coronary artery, and then they deploy this little balloon. The little balloon kind of expands. You can see that here, and it pushes out the plaque. And so this is a non-invasive way. Heart surgery, you have to like cut through the rib cage and you know, you're stitching into the heart. Here you can kind of go in and just push that blockage out. You can also use this before a heart attack to correct it if you see that there's a problem. Sometimes a stent is used to reinforce the opening. So here's that little device. The metal wire is going through. You got that balloon ready to be deployed, and there's this metal cage around it. And then when you inflate that balloon, the metal cage stays inside just to kind of anchor and reinforce that. And so here you have the artery before this was done, and then here you have that stent kind of pushing out that plaque and reinforcing the wide opening. And this picture is just cool, but it kind of gives you a sense of scale for some of these. These are pretty tiny in the case of the coronary artery, but in other arteries they could be larger. What about a heart rhythm problem? So if you have cardiac arrest, maybe it was just brought on by that blockage, but maybe there's some other problem with the heart, or maybe the heart attack caused another problem. And so now you've got a heart rhythm problem long term. Well, a pacemaker is used. You've probably heard of these. It's this little metal device, and they surgically implant it in the muscle of your chest. And then this wire goes into what you now know as the subclavian vein, and then it goes down into the right atrium, which is where that SA node is. And you can see these little like kind of grippers there on the end of these wires. That's used to kind of attach them somehow, I don't fully understand how, to the muscle wall. And pacemakers do different things. Sometimes they kind of constantly give that little steady beat to tell your heart to beat. More commonly though, they simply monitor the heart rate, and then if it gets out of sync, they give a little zap to restore the normal rhythm. There's this other thing called an implantable cardioverter defibrillator. And basically, this sucker, if your heart begins to fibrillate, it will like beep a few times, and then the beep is there to say if you're snuggling, get away from your snuggle partner, and then it gives a actual defibrillator shock to start the heart up again. So that's kind of an interesting one. The last thing I want to talk about here is cardiovascular disease and the brain. So we've been very focused on the heart because that's our unit of study, but the brain also is very at risk of cardiovascular disease. And you've heard of these, a stroke. A stroke, similar to a heart attack, it's a loss of brain function due to disrupted blood flow. In the case of a heart attack, it's the coronary artery that's blocked. In the case of a stroke, it's blood vessels going to the brain that are blocked. Now, there's actually different types. There are two main categories of strokes. The first one is kind of what we've talked about with a heart attack. It's just atherosclerosis, creating a blockage, and then all the brain tissue downstream of that blockage is going to die. But there's also another cause, which is called an aneurysm. So an aneurysm is this weak bulge in a blood vessel. So there's just this little weak area in the lining, and it causes the blood to kind of push out and create this little bulge balloon almost. These are actually fairly common, but most of the time aren't a big deal. Sometimes, and in my family, there seems to be a history of this, these do get weak and then they rupture. And you can imagine that is a major problem because now all that blood that's supposed to be going to your brain is leaving and pooling and causing all sorts of problems. So how do you fix this? Well, the old way is they would use a clip. They would just find that little bulgy area and they would clip it. And then blood can't go in there because it's clipped. This is tricky because you have to be able to access that part of the brain. So we're talking cutting into the skull, and then this blood vessel needs to be accessible to a surgeon without damaging other parts of the brain. Now they do coiling. And this works similar to that balloon angioplasty. They run a thread from your femoral artery. And by the way, they go through the femoral because it's kind of close to the surface and a big artery, so it's easy to access that way. They run this all the way up to your head, and then they deploy this metal coil, and they fill that bulge with this metal ball. And again, blood isn't going to go in there anymore because it's filled with this metal ball, and then that will prevent the aneurysm from happening. My aunt, I mentioned I had a family history of these aneurysms. We all go in and get tested periodically, and my aunt had some aneurysms, and so she had them coiled. So she has 3 of these little metal coils inside her head right now. Interesting side note, I got tested and it was really expensive, and it came back negative. And there was this little part of me that was annoyed that I didn't have an aneurysm. I was like, man, I paid all this money for nothing. But then I got over that quickly because I was very happy I didn't have an aneurysm. Anyway, so just to bring us back, there's obviously atherosclerosis is where we began with this, and you know, obviously atherosclerosis can cause lots and lots of problems. And again, most of these problems don't happen until you're old. And so I wanted to end with this diagram, just kind of remind you of all of these risk factors. And you live many, many years, you know, ignoring these things, and then all of a sudden you hit a certain age, and then the consequences of that start to hit you. So I would encourage you to, if you ever see a coupon like this, just pass on it, just tear it up. You don't need it, and keep in mind what kinds of things you can do to keep that cardiovascular system nice and healthy. Thanks, everybody.